Mackenzie Vaughan Hospital will be Canada's first smart hospital, featuring fully integrated smart technology and medical devices that can exchange information with each other, patients, and healthcare providers. Patients, families, and staff have been consulted at every step in the design process. To help us test our room designs, we built full-scale rooms that our clinicians used to analyze the spaces and equipment our team will use to safely and efficiently provide world-class care. Rooms featured represent current design. Colors, finishes, and other elements may change.
I think when you look for security and comfort in an area that you live, there's a dimension of healthcare that has to be local. And what Mackenzie Vaughan Hospital will do is add a huge amount of additional capacity and access, and will really improve, I think, people's ability to get connected into healthcare that much more quickly.
We're ultimately going to provide a great care experience for patients in a new and more exciting environment. So we're really excited about the new operating suites that are really state-of-the-art, modern, much larger than what we're used to using in the past. These are infection control grade. We have access to video monitoring so that the surgeries themselves can be recorded. We can connect remotely to other hospitals and to other medical specialists that will be able to actually monitor and follow along with the surgery remotely through video links. Most of the equipment will be on booms hanging from the ceiling, and this will allow for easier cleaning, less wires and less problems with potential tripping hazards, and improves the whole patient care experience. Most of the beds in the hospital will be for medical surgical type patients, and really excited about the advantages that we're going to have in the new hospital. With almost 80% of the rooms will be private rooms and single patient rooms with fantastic large windows with great view lines and sight lines. Another great feature of these rooms is the size, and every room has a sleeper sofa in them, which will allow patients' families to stay overnight. All of the patients will have their own private washroom with non-slip floors and showers and fully accessible toilets. So there's also a lot of safety features built into all the med-surg rooms, including patient lifts in every room, which will make those that are less accessible be able to move around, and to help with the caregivers so that they don't have repetitive injuries with lifting a patient. Every patient room has a supply server that will be able to store all of the equipment that's used on a daily basis by the caregivers and the nurses for every patient. Currently, we're one of the busiest emergency departments in the province, and we often see over 300 patients in the emergency department every day. Most of these new private examination areas will be an improvement over the traditional emergency department, where patients are separated mostly by simple curtains. Now there'll be much better privacy for the patients, much improved infection control practices, where the patients will be separated by walls and even glass doors to allow ease of access. There's going to be a patient care documentation area where the nurses will be able to access the patient record electronically from within the examination room. So the glass doors allow for privacy and have some infection control capacity, but they also, in an emergency, will break open and allow the patient to be moved in or out very quickly without having to squeeze through a smaller door. The critical care rooms are the areas where the sickest patients in the hospital are looked after. These are patients that are in need of a huge amount of intense treatment and care, and they require a very high-tech setting. So the critical care rooms, or intensive care areas, are really unique, really modern. The large windows in every room will also improve patients' well-being, both mentally, in terms of their confusion, delirium, and actually improves on their health. The beds that are in these critical care rooms all rotate around so that the patient can actually face the windows and look out as needed. All the critical care rooms also have a sleeper sofa within so that loved ones, family members can stay overnight if necessary in the same room with the patient. The critical care rooms were designed to allow for the nurses to be able to be outside the room, and they're able to look after the patient and monitor them. This improves on patient privacy and allows the family to actually have more room with the patient. There'll be over 30 mental health inpatient rooms at the new Mackenzie Vaughan Hospital, and these are specially designed to provide the most safe environment for these type of patients. These rooms are specially designed with features specifically keeping the patient who's at risk for self-harm in mind. These rooms are safe and will allow for the care providers to provide adequate care while keeping the patients as safe as possible. The head wall is different from in many of the other rooms in that the medical equipment is locked away in a hidden area so that the providers can get access to it easily but prevent the patients from potentially harming themselves. The special bathrooms are designed to minimize the need for any curtains or shower rods. There's no sharp edges, and many of the features are specifically designed for the patient who's at risk for self-harm. So one of the really exciting aspects to the new hospital will be what we call the LDRP, or Labor, Delivery, Recovery, and Postpartum rooms. This is the area where patients will be delivering babies, and the rooms are specially designed to allow for a real family experience. These rooms are large. They allow 3 separate zones. There's a zone for the mother who's going to be delivering. There's another area for the baby who's going to also stay in the room with the mother. And there's another section for the family with a sleeper sofa to allow partners and other family members to experience the whole birthing process together in a more family-friendly environment. These washrooms are really large, and half of them have separate laboring tubs, while others have independent large showers. So the whole labor and delivery suite area will have its own separate dedicated elevator near the emergency department so that mothers who are in labor will be able to move up to the special unit without having to cross the more sick patients that might be in the hospital.
So I feel it's important to thank the numerous people that have been involved in this project since its inception. It's no small feat to create a brand new hospital, and recognizing that this is the first net new hospital that the community and the province has seen in over 30 years. It takes more than a village to make this happen. Our staff, to our community that has believed in this, that has continued the advocacy to ensure that this project is front and center with the key decision makers, to our community that continues to hold us, the leadership of Mackenzie Health, accountable to making this project move ahead at the pace that it needs to ensure that come 2020, we have this amazing new hospital become a reality. I do believe that the residents of Vaughan and the surrounding community are going to receive care in the most modern, most contemporary, and most inviting facility that has ever been built in Canada. It will be state-of-the-art, it will be very human, it will achieve all the things that we've learned from other projects. We've tried our hardest as an organization to move the bar to the next level of what a hospital should look like.